If you're having SI pain, you are having pain on this joint right here. Usually people will point to one side of their low back and say, that's exactly where I feel my pain. This can happen from stepping off of a curb the wrong way, twisting weird. It can happen from bending over and picking up something incorrectly. And it could happen just from playing golf or playing with your kids or doing tennis. It doesn't matter. SI joint pain can just come on. It's really common during fertility treatments, pregnancy, postpartum, and then anytime our hormones are changing. So this pain is uncomfortable. People live with this pain for years, and the body compensates around this pain. And you can have like one hip that's tighter than the other. You might feel like you can stretch one hip better than the other. Then you might start to get some knee pain on the opposite side of your SI joint pain, or ankle pain on the opposite side of your SI joint pain. And the reason being is that the body is compensating. And so when you start to have pain on one side, you start to not shift away from that side. Well, that shifting away from the pain can actually make things worse. So you want to try to be symmetrical and maintain that alignment. Now, I want to talk a little bit about some postural cues that can actually like exacerbate the SI joint pain. And so some of these things that you might find yourself doing are really important to nip in the bud so you don't have this chronic SI joint pain. Now, I'm going to side note this. If you do have chronic SI joint pain, we specialize in this here at Body Motion Physical Therapy, and we are a pelvic floor physical therapy clinic, and we work on the entire body, balancing the compensations from inside the pelvis to outside the pelvis and through the abdominals. And so many people have this chronic SI joint pain because they've been to physical therapist upon physical therapist, but it keeps coming back because their patterns weren't truly fixed, because they never got the work inside the pelvis that needed to happen, or any scar tissue that occurred in their belly or in their pelvic floor that creates this chronic pull on the SI joint. And so we have to make sure that we address those in order to truly dissolve and create pain in that SI joint. So I hope that helps you get like a little clarity on why these SI joint pains happen and how we fix them. People fly in from all over the world to do intensives here at our clinic in Edmonds, Washington. And you can have like one hip that's tighter than the other. You might feel like you can stretch one hip better than the other. Then you might start to get some knee pain on the opposite side of your SI joint pain, or ankle pain on the opposite side of your SI joint pain. And the reason being is that the body is compensating. And so when you start to have pain on one side, you start to not shift away from that side. Well, that shifting away from the pain can actually make things worse. So you want to try to be symmetrical and maintain that alignment. Now, I want to talk a little bit about some postural cues that can actually like exacerbate the SI joint pain. And so some of these things that you might find yourself doing are really important to nip in the bud so you don't have this chronic SI joint pain. Now, I'm going to side note this. If you do have chronic SI joint pain, we specialize in this here at Body Motion Physical Therapy, and we are a pelvic floor physical therapy clinic, and we work on the entire body, balancing the compensations from inside the pelvis to outside the pelvis and through the abdominals. And so many people have this chronic SI joint pain because they've been to physical therapist upon physical therapist, but it keeps coming back because their patterns weren't truly fixed, because they never got the work inside the pelvis that needed to happen, or any scar tissue that occurred in their belly or in their pelvic floor that creates this chronic pull on the SI joint. And so we have to make sure that we address those in order to truly dissolve and get rid of the SI joint pain and create new healthy patterns that aren't going to wear other joints out and create pain in that SI joint. So I hope that helps you get like a little clarity on why these SI joint pains happen and how we fix them. People fly in from all over the world to do intensives here at our clinic in Edmonds, Washington, and they'll come for a week at a time to truly dissolve and get rid of this and start to build new patterns. So if you're interested in that, just drop us a note and we'd be happy to get in touch with you. Please like and subscribe to this video, and let me know if you have any questions regarding SI joint pain or your own personal experiences, and I respond to these directly to you. Okay, let's get going here. We're going to talk through the postural changes that you can start to make in your body to help reduce the SI joint pain. Okay, so here's the deal. SI joint pain is right, the SI is right here. So it's like the glute is here, and then we have our SI joints here. And a lot of people will be in this anterior pelvic tilt, and that helps them pop their glutes out, so they like the way their butt looks when they're standing in that posture. And then they just get used to standing in this anterior pelvic tilt. Well, that puts a ton of pressure and jams up these joints. Now, take this a step further, and they're going into their workouts or they're doing deadlifting, and they go into an anterior pelvic tilt and then do the movement. That is further creating a ton of stress and strain through this and through the SI joint. And so we want to make sure that we do our movements in correct alignment, where we're not in this anterior alignment, but we're more neutral. And neutral means that I have to turn my lower abs on to do that. Now, a lot of people don't have connection to their lower abs, and so that creates a problem in being able to maintain what we call neutral spine. To find your own neutral spine, what you would do is you imagine that if I'm wearing a ponytail here, I am in my posture, my feet are about hip width apart here, and from the side, what it looks like is if I'm wearing a ponytail, I can pull myself up to the side, up to the sky from my ponytail, and that's the position of my spine that it should be, and I should be able to maintain. Now, if I get lazy or if I am just used to it, I can pop into an anterior pelvic tilt. And I will tell you, when I was pregnant for so many years with all my 3 kids and then healing postpartum, it was easy to just stay in that anterior pelvic tilt position. But that creates a lot of problems. And then you see people go into a posterior pelvic tilt and kind of hang out here. And that creates another terrible pattern, because then we're really squeezing our glutes, but it doesn't mean we're working our glutes in a good way, because we actually lose hip extension if we're just hanging out in this posterior pelvic tilt. And that puts a lot of pressure on the SI joint as well. And so even if you're jamming the joint in an anterior pelvic tilt, or you're creating more strain in a posterior pelvic tilt, that is going to create more pain in the SI joint. So you have to be able to find your neutral spine alignment that is going to take the pressure off of those SI joints. And again, you want to do this so that you're in your daily life holding your neutral spine posture. But then when you go to do your workouts, or you go for a walk, or you go engage in whatever physical activities that you like to do, gardening, you're maintaining that neutral spine position, so you're not getting into these anterior and posterior pelvic tilts that are going to shear and cause a lot of pain and pressure through that SI joint pain. This is all going to be amplified if you've already had kids, because oftentimes when the pelvis comes back together after you've had babies, that it doesn't always come back together in this neutral alignment. A lot of times the body has compensations. So unless you've been through a good protocol that has already balanced your pelvic floor and balanced the hip muscles, you are most likely going to have asymmetries, just like one side tighter than the other, or maybe your pelvis didn't come back together all the way, or maybe it came back in a wonky position. And so we have to balance those positions to take the stress and the strain off these SI joints. And so I hope you find that helpful, and that gives you a little clarity into maybe what's going on with your SI joint. And so what we want to do is we want to balance everything around and inside the pelvis to take the strain off these joints from the outside and take the strain off these joints from the inside. And as you can see, a lot of the pelvic floor muscles that attach here have connections to the sacrum, which if it's tighter on one side than the other, that's going to create more strain on the actual SI joint itself. And so we want to balance all of these joints. So I did a video, part 1, of how to initially balance some of the joints. This is part 2, and we're going to add a couple more stretches to the game so that you can start to balance these joints. And if they're not working for you, then you really need to work with a pelvic expert who can help balance all of these muscle groups so that you aren't finding chronic SI joint pain, which is terrible in itself, but you also don't want to wear out your other joints. So the very first thing we're going to do to balance the muscles on the outside of the pelvis is we are going to take a lacrosse ball, and we're gonna rub it on our glute medius muscle, and then some of our glute muscles below, so the glute max will hit, and then we'll hit some rotator muscles. So what this looks like, you'll take the lacrosse ball, you'll stick it right behind your glute against the wall, and you're gonna put some pressure on it. You're gonna find your hot spots. You're gonna find the spots that are a little tender. And this isn't right at the SI joint. You're going out away from it because you're going to some of the muscles that are controlling the position of the SI joint. And so the glute medius is a great one to hit first. And then we're gonna come down and we're gonna go down the glute. So first I'm starting up here, then I'm gonna work my way down the glute into the rotators. And you're essentially just finding all the painful points and you're hanging out there. And let those, once you hang out there and they melt away, then go find a new spot. That might take you 2 minutes to melt each spot. It might take you 30 seconds, but spend at least 2 minutes on each side minimum. And you want to make sure to do this on both sides. You do not want to do this just on the painful side, because a lot of times it's the other side that is so tight that is creating the strain on the other SI joint. And so we want to make sure that we hit both sides. Okay, so that was the glute ball release. The next stretch that we're gonna do is gonna be to hit our glutes again. And you can do this in a sitting position along with me. Okay, so in a sitting position, we're gonna cross our leg here and go into a seated, what we call a piriformis stretch, where we get the little rotator muscles. You can hold this for up to 2 minutes, trying to open up the hip. You're sitting up nice and tall, and you should really feel that nicely in the hip. Now, if that's painful or hurting on the front of the hip, this is not a great stretch for you, at least not yet. The next move would be, you can bend this leg up towards your opposite shoulder and feel that in a little bit more of a different spot through the glute. These are 2 of my favorite glute release stretches that help to balance the pelvis. You can do this while laying on your back. You could do this in a pigeon pose if you're familiar with that one. Or you just do it sitting in the chair. I like sitting because you can just work it into your day. If you're sitting down for dinner, sitting at a table for a lunch, or you're working through the day in a seated position, just hit this stretch a little bit. And this can be a really great one. So you have the lacrosse ball release, you have these seated glute stretches. The next one we're gonna do is just simply a quad stretch. So I like to do the lazy man's quad stretch. You can find a quad stretch that works for you. But what I do here is I have my handy chair and I just bring my leg up and I put my foot on the chair and I stand up tall and I pull in my lower abs and I get a nice stretch here. Now, if that's not enough stretch for me, I can always grab my foot and hold on. If you have more adipose tissue or you don't have the mobility to grab your leg, then just find something higher. Sometimes I'll use the back side of my couch and I'll come up here and do it like this. But the deal is you want your foot going straight behind that glute. You don't want to cross, you don't want this arm to cross and hold here. That's going to put a little bit more of an angle force through the knee, and it's not that good for you. So this can be a great stretch. You can lean back to take it a step further, pushing this hip forward, and you're just getting a nice quad opener. And again, this has a pull on the actual SI joint. So these are 3 additional exercises that you can use along with the other video that we went through earlier. And all of these help balance the SI joint. Now, we never talked about balancing the pelvic floor, but that can be done with a pelvic expert. And what we do is we balance all the muscles internally. There are 3 layers of muscles: fascia, lymphatics, and blood vessels and nerves. And they all have to be able to move and have really good mobility. And if we don't have mobility within these layers of the pelvic floor, they're gonna have tightness, and that can pull on that SI joint. So a lot of times the reason we're seeing people after they've already tried physical therapy and chiropractic and acupuncture and done all those things is because the pelvic floor muscles have scar tissue and or don't have the blood flow and or they don't have the mobility which means that they can't move and contract and relax as well because of childbirth, or because that maybe they were never connected to their pelvic floor, so they don't really know how to use it. So you can be the fittest person in the world, but you can have a pelvic floor that doesn't have as much movement, which can create a lot of chronic pain through the hip joint and that SI joint. And so we have to heal those compensations in order to truly heal the SI joint. I hope you found this video helpful. Please like and subscribe and share this with all your friends that are dealing with SI joint pain. Take care.